Today I'm going to discuss about the glycogen metabolism and its diseases. Basically, the glycogen storage disease. The what is the glycogen? So glycogen is basically the storage form of the glucose. It is the storage form of glucose. So, so glycogen is maybe linear and have branched. So branched glycogen have alpha 1 6 bonds, while linear glycogen has alpha 1 4 bonds. So glycogen synthesis take place in liver and skeletal muscle cells. So the glycogen that's present in the skeletal muscle is used during exercise, while the glycogen that is present in the liver cells as a storage form of the glycogen is utilized when there is a fasting state or the state of the hypoglycemia. So the glycogen regulation mainly takes place through insulin and glucagon and epinephrine. Insulin lead to the increased glycogen synthesis, while glucagon and epinephrine lead to the decreased glycogen. So when is the fed state? What happen in the fed state? Increase insulin after the meal. This insulin act on the liver and the skeletal muscle. There is the tyrosine kinase receptor present on the liver and the skeletal muscle cells. What happen? This receptor activate the enzyme protein phosphatase, and which ultimately activate glycogen synthase, which is the rate limiting and rate determining step of the glycogen synthesis. So this glycogen synthesis convert this glucose into the glycogen, while the second is the glucagon. So glucagon and epinephrine acts on the liver and the skeletal muscle again. So the epinephrine acts through the beta receptor and alpha receptor on the liver and the skeletal muscles. So what happen when the glucagon is act on the receptor on the liver? What they cause increase in adenylate cyclase enzyme. This adenylate cyclase enzyme convert the ATP to the cyclic AMP, and this lead to the increased synthesis of the protein kinase, and this protein kinase ultimately cause glycogen phosphorylase kinase. So this lead to the increased synthesis of glycogen phosphorylase, and this glycogen phosphorylase convert this glycogen into the glucose. So another mechanism of action of the epinephrine and is through the endoplasmic reticulum. As we know that the endoplasmic reticulum is rich in the calcium. So when it is activated by through the alpha receptor through the epinephrine, the calcium is comes out in the cytosol, and they act through the calcium calmodulin in muscle during the contraction. And what happened? They again glycogen phosphorylase and kinase is activated, and they ultimately lead to the uh, synthesis of glycogen phosphorylase. As we know that the function of the glycogen phosphorylase is convert the glycogen into the glucose. The glycogen storage disease is basically the diseases that is occurred due to the deficient in enzyme that involve in the glycogen synthesis and its metabolism. So what happened? This glucose is basically converted to the glucose 6 phosphatase by enzyme hexokinase and glucokinase. While this glucose 6 phosphate is converted back to the glucose by the enzyme glucose 6 phosphatase. So phosphatase remove phosphate from the substrate. Next, this glucose 6 phosphate is converted to the glucose 1 phosphate, and this convert to the UDP glucose, and this UDP glucose ultimately converted to the glycogen. So this enzyme is a glycogen synthesis, and it is the rate limiting enzyme. This one is the rate limiting enzyme. So this glycogen is converted into the branch form. This is the linear form of the glycogen. This is converted into the uh, branch form of the glycogen through the branching enzyme. So if this branching enzyme is deficient, it will lead to the Anderson disease, while this branch form then convert into the limit dextrin. Limit dextrin is basically the structure that formed by the action of the glycogen phosphorylase on the branch form of the glycogen. Basically, this remove 3 to 4 glucose residue from the branch of the glycogen and add some of them to this linear glycogen. So, and some of the glucose is released in this way from the glycogen. So, if this glycogen phosphorylase is deficient, then it will lead to the McArdle disease. So, it will lead to the McArdle disease. Anderson disease is basically due to the decrease in branching enzyme. Next, this is the limit dextrin. This limit dextrin is converted into the another form of the glycogen where this branch is a debranching enzyme. This branch becomes shorter by the debranching enzyme. There are two debranching enzymes. Here is a one and here is another. So one is first is the debranching enzyme is a 4 alpha gluconotransferase, and this one is the alpha 1,6 glucosidase. So if these two enzymes are deficient, it will lead to the Cori disease. So Cori disease is again high yield stuff. If these two enzymes are deficient, it will lead to the increased limit dextrin in the patient. So it will ask in the exam. Next is the basically this linear glycogen, and this glycogen is basically the convert back to the this glucose. So basically the some portion of the glycogen degradation takes place in the lysosome by the enzyme alpha 146 glucosidase, also known as acid maltase, and another enzyme that directly convert this enzyme this and directly convert this branch glycogen into the glucose is alpha 1,6 glucosidase.